Tennis elbow can be really frustrating. It's a condition that I see and treat with my patients all the time. In today's video, we're going to get into all the different ways you can treat tennis elbow, including ways to avoid surgery. Hi, my name is Mark Gruner. I'm a board-certified sports medicine physician. I treat thousands of patients with tennis elbow. In today's video, we are going to talk about my treatment approach to this medical problem. First, what is tennis elbow? Tennis elbow is also called lateral epicondylitis. It is a common cause of pain on the outer side of the elbow, where the tendons that are responsible for your wrist and hand insert on the elbow. It can happen to people after repeated wrist or forearm movements, such as gripping, lifting, or twisting. Most people do not know that tennis elbow can actually get better on its own within 6 to 12 months. What's even more surprising is that using the arm, even if it's sore, does not cause more damage. When I tell my patients this, it helps to reduce their fear of activity and keep them active while the tennis elbow heals. When treating tennis elbow, I like to tell patients to start with physical therapy. Physical therapy can improve pain and strength with very little risk. Stretching and strengthening exercise for the forearm muscles can help patients with tennis elbow. Manual therapy such as gentle massage or joint movement may give short-term relief, but it does not always last. For pain with tennis elbow, topical anti-inflammatory gels or creams can help with short-term relief. If pain is strong enough, oral anti-inflammatory medicines can be used for a very short time. Some people benefit from elbow straps, elbow braces, or wrist braces. This can help reduce pressure on the sore area. When you put an elbow brace on your area, you want to put it on 2 centimeters below where the bony prominence of your elbow is. That allows all the tension to stop at the brace, giving the tendon that could be injured time to heal. When physical therapy and pain medications don't work for patients with tennis elbow, injections can be an option. You may be thinking these injections are steroid injections. This is because even though steroid injections may bring quick relief for tennis elbow, in the long run, steroid injections can make things worse and can injure the tendons. So what other types of injections can you use from your doctor to treat tennis elbow? Before trying surgery, there are 2 treatment options that I like to talk about with patients. One is called PRP. PRP, or platelet-rich plasma, is one of the treatments that we use with patients to avoid elbow surgery. PRP is sometimes used for long-lasting treatment for patients who have been suffering from tennis elbow for a long period of time. Studies show that PRP might help patients in the long term, especially compared to steroid injections or physical therapy. These benefits seem stronger when you use a high dose of platelets. Results, however, depend on the patient, the skill set of the doctor, being able to do them under ultrasound and getting the length and the width of the tendon that's injured, and making sure that they're using the right PRP preparation. For people who haven't improved with regular treatment and don't want surgery, PRP may be a good alternative. In fact, some studies show that PRP can work as well as surgery for pain and function in chronic tendon injuries. Another option for tennis elbow is a percutaneous tenotomy using the 10X device. This is a procedure where a small incision is made, and then under ultrasound, a device is guided to the injured part of the tendon, removing the injured tendon while preserving the rest of the normal tendon. Other treatments like shockwave therapy and ultrasound can also help reduce pain and function and improve grip strength. Shockwave therapy seems to work a little bit better than ultrasound in recent studies, but both are best used along with exercise, not as replacements. If pain continues beyond 6 to 12 months, despite all other options, surgery may be considered. The goal is to remove the damaged tissue, part of the tendon. Whether it's done through an open surgery, arthroscopically, or a small needle technique, they all have similar results. Tennis elbow really should be treated step by step. What questions do you have about tennis elbow? Drop them in the comments below, and I will try to answer them in the future video. Hope you found this helpful. Remember to hit like and subscribe below, and I will see you in the next video.